As you learn about or prepare for a blood or marrow transplant, there may be many new words that you'll hear. One of them is HLA matching. HLA matching happens once you and your doctor have decided that an allogeneic transplant is your best treatment option. When you have an allogeneic transplant, your healthy blood-forming cells, also called stem cells, come from a donor. Your doctor wants to find the best possible donor for you. HLA matching is used to match you and your donor. The best possible donor is one whose HLA is very closely matched to yours. HLA stands for human leukocyte antigens. They are proteins found on most of the cells in your body. You might hear people say HLA markers. Your immune system uses HLA markers to know which cells belong in your body and which cells don't. HLA matching is much more complicated than blood typing because there are many HLA markers that make a person's cells unique. Finding a close HLA match is very important. A close HLA match makes it more likely your transplant will work and treat your disease. It also helps lower your risk for complications after the transplant. A close HLA match helps your donated healthy blood-forming cells engraft. Engraftment means your healthy cells have started to grow and create new cells in your body. You can learn more about engraftment by watching the video, What is Engraftment? HLA matching starts with a blood test. Your blood is tested and compared to any potential donors. This is much more complex than testing your blood type because there are so many HLA markers. Usually, doctors want to match at least 8 HLA markers, and many doctors want to match 10 markers. But sometimes patients get healthy blood-forming cells from cord blood units. For these patients, doctors may only need to match 4 to 6 HLA markers. To find a close HLA match, your doctor will start by testing members of your immediate family. This is because HLA markers are inherited from your parents. You get half of your HLA markers from your mom and half from your dad. Each of your brothers and sisters who share the same mom and dad as you have a 1 in 4 chance of being a match. Your biological parents and your children will always match half of your HLA markers. Doctors are studying how transplants using cells from a half-matched family member, also called a haploidentical donor, may be a treatment option for some patients. About 7 out of 10 people won't have a close HLA match in their family and need to find healthy blood-forming cells donated from someone else, either an adult volunteer donor or donated umbilical cord blood. If you don't have a close match in your family, then your doctor can search the Be the Match registry. Because the registry is so large, your likelihood of finding a match is between 66 and 99%, depending on your ethnic background. Since HLA is inherited, your ethnicity is an important factor in HLA matching. People who share your ethnic background are more likely to be a close HLA match. If no suitable donor or cord blood unit can be found, your doctor will look at other treatment options.
Human leukocyte antigen typing is a blood test or a cheek swab test performed in order to identify the most suitable donor for a patient needing an allogeneic blood or marrow transplant. An antigen is a protein on the surface of the white blood cells, also called leukocytes. HLA proteins are on almost all cells of your body. These proteins play a very important role in your immune system. You inherit half of your HLA genes from your mom and half from your dad. The HLA antigens are crucial in choosing a donor for a person needing a stem cell or marrow transplant. 2 groups of HLA antigens are important to typing: class 1 antigens and class 2 antigens. HLA is complicated in that there are thousands of HLA markers, so it is much harder to find the stem cell match as compared to, for example, a red blood cell match, where there are so few red blood cell types, like A, B, and O. A total of 12 antigens will be evaluated for a possible match with your child. A perfect HLA match means that all of the donor HLA antigen types are identical to the recipients. This is important because it minimizes the risk of graft versus host disease and graft rejection. This will be most likely within the immediate family, as there is a 1 in 4 chance that a sibling can be an identical match. There is also a 1 in 2 chance that a sibling will be a half match. Parents are always at least a half match to their children, since, as mentioned before, a child receives half of their HLA genes from each parent. Some unrelated donors or unrelated cord blood units can also be found in a national donor registry, the National Marrow Donor Program. But this is not always an option for every child or patient. There are certain HLA combinations that are more common in people of certain races and ethnicities. It's harder for people from minorities, such as African American or mixed race, to find unrelated donors, as there are less people from those minorities in the National Marrow Donor Program registry. In the event that an HLA identical match cannot be identified, your physician may recommend a haploidentical transplant, which is when the donor's HLA typing is a half match to your child's. All biological parents are haploidentical with their children, and there is a 1 in 2 chance that a sibling will be haploidentical. As the risk of graft versus host disease is higher in haploidentical transplants, the stem cells may be manipulated in the lab before infusing them to you or your child, and this would be done with a procedure called alpha-beta T-cell depletion, or additional chemotherapy may be given after transplant to reduce the risk of graft versus host disease. Other options, should there not be a match, would be a mismatched adult unrelated donor or a mismatched unrelated cord blood transplant. And your doctor will be certain to talk about these options with you and how to minimize the risk of graft versus host disease. Also, your doctor will make sure to test you for antibodies in your blood against your donor HLA antigens. If antibodies exist, it would make the transplant more risky and increase the risk of rejection.